Dr. Karupa Swami. Dr.
Next
Karupa
is?
Swami. Dr. Karupa Swami, I think.
Your pronunciation is like the Tamil Nadu, they say it is Karupa Swami. You are telling Karupa Swami, like a girl.
In the North Indian style.
Yeah, no problem. Same way South people pronounce the North names as odd. Okay.
Exactly. But I think they are not in a
He is
meeting.
not there. Yeah, he's absent.
Yes.
Next is?
The Dr. Ishika Singla. Ishika.
Ishika Singla is there, but not on the screen. Is she going to come on the screen or not on the screen? What was the time slot, Ishika Singla?
5:20 to 5:30. Sir, you are muted. Sir, you are muted.
No, you can unmute her. Yeah.
Okay. Yeah, she is on the screen, sir.
Unmute her.
Yes, sir. Sir.
Sautam Vinay Kumar.
Done, sir.
Good evening, sir.
Yeah, your question.
Yes, sir. In rheumatoid arthritis, should we use ice pack or hot pack? And
Why? This is different questions. Your questions are different.
Yes, sir.
First, second, third.
Yes, sir.
Okay, let's see one by one.
But from the same patient.
Why do you think only these two options are there? Hot pack, cold pack, only option is there?
No, no, sir. Means at a home program, should we use ice or hot?
That's what I'm telling. Home program, nothing else you can use. Only hot pack or cold pack. If I'm asking you, for evening you want tea or coffee means, you will tell, no, I will take juice. You understood what I'm trying to tell?
Yes, sir.
Why are you asking only tea or coffee? I'm asking. Rheumatoid arthritis is not a vascular disorder. Vascular disorder which has a temperature intolerance, temperature maladaptation, only you will use thermal modality. Thermal means heat or cold. Otherwise, why you have to use that for rheumatoid arthritis, which is an autoimmune disorder of connective tissue, affecting ligaments and capsules and the synovial membrane? What effect you are going to achieve with the hot pack or even the cold pack? And why the options are very narrowed, like whether to give hot or cold? It is like even strangers come to the house, we ask, you want hot or cold? Hot means coffee, tea. Cold means it is the soft drink. Yeah.
So what we would use in rheumatoid arthritis?
I will not do anything for the rheumatoid arthritis because I will not look at the disease at all. I will look at the patient. What is the problem? Patient has problem in walking. I will train walking.
Yeah, patient is walking and with present wrist pain.
So that is why I am telling, focus away from the name. For example, there may be another Ishika Singla here.
Yes.
It doesn't mean you and her are same. So don't treat rheumatoid arthritis as acute stage, subacute stage, chronic stage. Acute stage, there is warmth and swelling, and then you give cold pack. Chronic stage, there is no warmth and swelling, so you keep hot pack. You palpate the joint, there is warmth is there, so you keep cold pack. Palpate, there is no warmth, so you keep the hot pack. That is not treatment. You have to see, is it a vascular problem?
Yes.
No. Then why you give thermal modality? And the next one, joint is stiff, give joint mobilization. Muscles are stiff, myofascial techniques. Nerve entrapment is there, neural mobilization. Enough. If functional activity prescription intolerance is there, exercise testing and the prescription should be done as per individual each person physical activity level. If it is to do with the deformity, then you see for how functional activity is not limited because of the deformity. So splinting, dynamic splinting. If the patient has night pain with the deformity, then you go for static splinting only for the night, called as rest splinting. If the
So
patient feels that smoking, he smokes means he feels better means, tell him to do smoking.
relieving factor.
Whatever the patient psychologically feels that it's making symptoms better, patient can do.
Okay.
Patient feels better with having drinks, alcohol, let him take. But you cannot tell that take alcohol as a prescription. Same way hot and cold pack is like that. Some patients tell, I keep hot pack means I'm feeling better. They want the heat from you, the heat modality from you. So that means they expect that it is thermal modality should be there. So you can tell them that you continue doing that at your home.
Okay.
Because this is not a pathology which is going to be treated with therapeutic heat or cold. It's not a superficial problem at all. The joint is deeper. If there is a deformity and you want to mobilize the joints, maybe a wax bath is better for the hand or the foot. Otherwise, you will see that which region it is and what type of problem. People who have myofascial pain, rheumatoid arthritis people will have trigger points in the muscles. So that trigger points, he will tell that cold weather means it aggravates. I put warm water, I take bath means I feel better. So for them, you give hot pack, obviously they'll feel better. But it's not a treatment. It's just a pampering. It's just a time pass. In between treatments, what you can give to keep the people occupied, be having them in the clinic. Okay, for that purpose. It's not actually a treatment at all. Okay, next question.
Patient physiotherapy management for weight reduction. But we can do only stretching, strengthening.
No stretching, no strengthening. Weight reduction means obesity and exercise prescription. For that exercise prescription, there are protocols of exercise testing. Some of the examples are Bruce protocol. And then exercise prescription depending upon the parameters what we assess. What are the changes that came during the exercise testing? How is the ECG during the exercise testing? We don't prescribe the exercise depending upon the body weight, depending upon the waist-hip ratio, or the body mass index, or the blood cholesterol level. Depending on that, we don't prescribe the exercise. We prescribe how is their performance of exercise. If it is free of symptoms, then we do 60 to 80% of maximal effort. They have to do the exercise. Otherwise, we tell submaximal, which is like 25 minutes of walk and then 3 days a week. That itself is enough. That is done everybody by park and everywhere. But you want to be as a physical therapist, utilize the treadmill, do the scientific testing and then prescription. Stretching, strengthening and all will not reduce weight. It will reduce only the therapist weight. Okay? Not the patient's weight.
The weight.
Yeah?
Yoga is not beneficial for weight reduction.
We cannot tell that. For me, taking class is beneficial for weight reduction. If I don't take class means I put on weight. So taking class, is it a treatment for weight reduction? What I'm trying to tell is each patient will have their picture.
Yes.
What way it increases, reduces. See, obesity also primary, secondary. You have that inherited obesity which is there. People don't eat anything. They are fully tensed. They put on weight. Other people, they lose the weight when they are tension. These people put on weight when they are tensed. So there are different categories of people for that obesity. Don't evaluate every Ishika as Ishika. Every Ishika will be different. Nah? Same way, every obesity will be different. So that is where the patient-centered examination has to be there. That is where you are becoming a clinician rather than a gym trainer who's like, whoever comes, I have to reduce 5 kg in that 1 month. What is your package? 15 kg in 1 month. Okay, come. Start with this. Start with that. Do this warm up. Do these exercises. Monday this one, Wednesday that one. 1, 2, 3, 4, 5, 6, and the patient gets a heart attack. That is why now recently gyms, everybody is getting heart attacks, cardiac arrest, and they're dying in the gym because there is no physical therapist. The physical therapists who are there are behaving like gym trainers. They're not behaving like clinicians. Being a clinician, we think that it will take a longer time. It will take a long process to do certain exercise. Rather than that, give these exercises. You want the arms to be nice. Here fat is there, you want to reduce, do the arm exercises. Waist fat is there, do the abdomen. Nothing will happen. Regional exercises, nothing it will do. Swimming, full body exercise, jogging, walking, any kind of sports, all this activity-based prescriptions, even brisk walking, everything, that is a full generalized exercises for generalized. It is to do with the balance between the symptoms of the patient. Everybody who is obese need not be given exercises. Obese people are there who are much more stronger, much more endurance is good. They are actually highly physically fit compared to the lean people who are sleeping every time and eating nicely. Why they are eating nicely? Because they know eating nicely also they are not putting weight. So they are eating fully pani puri everywhere, evening. Okay, go to Starbucks, go to pizza, everything they have. Friends will be paying the money, of course. For obese people, nobody will pay the money. Obese people are alone. And also you see that they don't eat much. They're already conscious. Okay. And still they'll be putting on weight. So there may be endocrine causes, hormonal imbalances. So it is a comprehensive picture. Nowadays, it's not only obesity. It is diabetes always comes together. It's more called as a metabolic syndrome because of sedentary lifestyle. So the cause is sedentary lifestyle only. Our physios only. You take all our 2.5 lakh physios. See that 1.5 lakhs are obese. And nobody can pass any physical fitness test. Physios. Students, 1 lakh students, take them. 70,000 people are sedentary and obese. Students. Senior therapists are much more physically active than the first year BPT. So think that what are the broadest aspects of exercise testing and prescription, not like local treatments. Cellulitis is there, obesity. So I will do what? Needling, or I will do IASTM for mobilizing the cellulitis. Nothing will happen. It is all only eyewash. Okay. So scientifically, cardiopulmonary rehabilitation or exercise prescription comes under sports and exercise science as specializations, fitness prescriptions like that. So that is like non-communicable diseases. Under that obesity comes. So it is a generalized treatment which is important. Right. Next question.
Sir, sorry, sir.
Okay, ma'am. Next. She has not completed 3 questions, ma'am.
Patient with knee pain having stretch pain in lateral side of the leg. She said there
Which
is
pain?
there is a stretch feeling when she up and sits and stands.
Where is the stretch feeling?
Lateral side of the leg.
Lateral side of the leg. Name the structures in the lateral side of the leg.
There is tibialis anterior and popliteus.
No. Tibialis is medial. Laterally, which structures?
Peroneus muscle.
Peroneus? Longus and brevis.
And
how do you check the peroneus longus and brevis? Okay, other than peroneus longus and brevis, which are the structures? Laterally in the leg.
not able to remember.
That's why you just think that you know that why laterally stretch means what is getting stretched. Who are all there only can get stretched. A medial structure cannot produce a stretch on the lateral side. Yes, tibialis anterior proximally it is there lateral, but it won't produce a stretch laterally. It will produce symptom medially only because its insertion is navicular. So you have to see that peroneal nerve is there, common peroneal nerve. Artery vein is there. And you also have periosteum, fibula, intraosseous membrane, all this. If it is going to the knee, I will think of lateral collateral ligament, iliotibial band, biceps femoris, lateral gastrocnemius. Everything comes to my mind. Then I see that stretch. Yes, stretch. I check all the structures. I will know that which one is reproducing the patient symptom. And then the stretch symptom comes with stretching or stretch symptoms comes with walking. Stretch symptoms comes with walking means I will do the treatment in walking position, not in the supine line. This is again I am highlighting functional aspects.
So what
So
treatment?
try to see that.
What treatment we could give in walking?
That and all is not outside. It's only 3 questions that are permitted. You can take courses of the AOMPT. And remember that we have courses for everything. Lateral ankle sprain, 3 hours. 1 hour pathomechanics, 2 hours manual therapy. Heel pain, plantar heel pain, 3 hours. 1 hour pathomechanics for heel pain. 2 hours of manual therapy for heel pain. If it is neural means neural techniques, neural manual therapy, common peroneal, or even the sural versus saphenous nerves. So
I think sir is having a call in between the session. No? So it's
break.
yes, Ishika ma'am. Come on the screen. Yes, ma'am. Unmute yourself, ma'am. Ma'am, unmute. Just a minute. Yes, ma'am. Ishika ma'am.
Yes, ma'am.
Yes. So your all questions are complete.
Yes, ma'am. I have completed the question.
Anything you want to ask?
No, ma'am. Thank you.
So the sir was explaining you that how you will check that in which structure, like if you are talking about the lateral side structure. So just see that proper chain of that lateral side, what structures are going in a pain according to the functional demand of the patient, what type of functional activity he or she is not able to perform. So first check it. Like sir was saying that you have to treat the patient in their same
I got it.
activity. Yeah. If sit to stand is painful, then treat in that the sweating position. If there is a standing pain, then according to that, you can plan your treatment. And for your better upgradation, you can take the course where sir has explained in a full detail with the pathomechanics, because this is the beauty of AMPT, that we have a treasure of that videos. Whenever as a clinician, I will suggest that take if whatever type of condition you are seeing daily in your practice, you can take that type of courses so that you can upgrade. Because as I always do, we have a videos of that particular courses. If we stuck somewhere, we just open that video, we see that how sir has solved this problem, so how we can easily manage that problem and we can give a best result to our patient by treating in a proper way. Because there is only not only a one structure is going in a pain, because if there is a problem in a joint, definitely it will affect the myofascial also, or it will give the entrapment to the nerve also. So how we can combine these treatment? We have a very best approach in our AMPT, ortho-myo-neuromanual therapy, where we simultaneously treat all the, like the patient is in neural position, then we treat the articular and myofascial also. So this is the way you can treat and you can upgrade yourself. Because not we are not here as a physiotherapist to just see the MRI or the X-ray and start our treatment. We have to see all these things. That is the reason why sir has given the name of this session, the clinical decision making, how you can evaluate by taking the history, or what are the structure, either the articular, myofascial and neural, or the one of the participant has asked about that, how the central sensitization it also works, how we can treat the patient with the central sensitization with the pain neuro science. That is also a very important part of our physiotherapy and the motor control. So these are the things nobody explain in a detail, but in AMPT, sir always start all the treatment with the motor control, with the central sensitization, because 50% we treat to the patient with the brain only. After that, we move forward, because once in the first sitting, if you have given the relief to the patient, that then they will think that, yes, I am on a right place where they can understand my pain. So according to the symptoms, either the symptoms are intermittent or the constant, we have to distinguish between that, because this is give the main clue to the treatment, that if the patient is only in some activity they are feeling pain, then it is okay. And if there is a constant pain, then it means there is a some in the inside there is some infection, inflammation, or there is a some malignancy. So these, in that type of patient, always they have a constant pain. So this is the distinguishing we have to do by taking the history from the patient, or the patient is having a pain in a static position or in a dynamic position. That is also a very important thing, because some patient only if they are sitting normally or they are lying down, they don't have any pain. But as they start their working, they feel pain. So this is also the major point when we differentiate between the pain according to their pain structure. That is also very important. Either like the first case study, sir was showing that how the knee problem, the bilateral knee, but the right is more than the left. Sorry, left is the more than the right knee, but right knee is getting worsened because of that left knee. So this is also that how we can check that the both the limbs, either the dominant and the non-dominant. That is also because when we do the stair climbing, which leg is going in a first in a forward position, then other leg is in a following position. So that also we have to differentiate between. Or if the patient is having a main problem in a stair climbing, so we can give our treatment or the mobilization with movement with that particular action. For that also we have the courses, and the very best course, I think, no I will say we should never miss that type of courses. That is a functional neurostabilization training that really helps all the physiotherapists to treat their patient in a functional mode, where we give the neural stabilization training to the patient so that they can easily perform their activity. That is a very multi-dimensional course of AMPT. And like the neuro patient also we treat, like the stroke patient, Parkinson patient, there also we apply. If there is a, like you were saying, the stretching, people say that we want to give the stretching, but in AMPT sir always say that no need to stretching, just give the activation, that give the contraction to the muscle itself, the fasciomuscular release. That is very much enough for the patient. So there is no need for any stretching, because you are activating the muscle. If muscle is activated, so there is no need for any stretching also. So you have to train the muscle for working. So there is no need to just stretch them. So this is also a very important thing from today's session. We have to note down this, what we are going to do, either the stretching or the activation of that particular muscle. So it is a, I think, very important session which sir has planned according to all of your questions. We all are learning, because when sir is giving the answer, sir is adding so many points. So that points gives us a best view, because when we see in our clinical practice this type of patient, then we remember, yes, sir has explained in such a way that we have to follow. So we have to note down all these things, that how we can treat the patient, like the previous participant, that pyriformis, how we can treat the pyriformis itself. It's a very, because nowadays we know that the pyriformis patients are we are seeing regularly, we see the pyriformis with the differentiation between the sciatica pain. So that is also because that is the pseudo sciatica and that is the true sciatica, how we can differentiate with the patient symptoms. So that is also very important thing. So how we can differentiate. So knowing the base is very important to treat the patient. So how we can make our decision to treat the patient by taking proper history evaluation, and how then we can plan the treatment. So this is the format of today's session, which sir was explaining in a very nice way, and in a very simple way sir was explaining. so that we all can learn from sir answers and we can learn from all of your questions and my question also. So this is the way we learn in AMPT always. Dr. Silka ma'am, she knows very well. She is familiar with AMPT. So she knows how we contribute our input in every session, and sir always gives us a proper time how we can contribute. So this is also a very important thing. Upgrade yourself. Don't think that these webinars are enough for upgradation. Whenever you get time, whenever you can plan, just you want to learn something, take a one course. You start with a single one course. You will see the change in your hands when you will keep your hand on your patient. Now, you will feel satisfied. You will feel confident that yes, I know the right thing. I am not doing any wrong thing with my patient. I am not just keeping a strap on my eyes, or I am not treating blindly. Oh, here is a pain. Yes, I will treat it. Today, this is not work. Tomorrow, I will do this. So this is not here. We have to just focus on that. What is the pain? Either medial side. Okay, I have to check all the medial structure, what they are going to, either the medial hamstring, medial collateral ligament, medial meniscus. So there are so many things to treat in a medially. What are the role of adductors there? How we can release it? How we can treat the check the quadriceps? And even muscle strength testing session video itself is a mandatory for, I think, for all the physiotherapists, how you can check the strength of each and every muscle. That is also a very important thing which we have in the last month. We have finished our course for the muscle strength testing, so that you should not miss that. It will really help all the students, all the clinicians. They can upgrade their self by checking, because that is not a muscle strength testing that you are asking from the patient 0, 1, 2, 3, 4, how much is the pain. So that is only that verbally it's okay. But when you do the muscle strength testing, which muscle is in adhesion, which muscle is in shortening, then you can release, you can decide either you have to give the myofascial release, either you have to give the lengthening. The muscle is in a tight position, muscle is in a sparse position. There is a trigger point, how I can release it. For that, we have many things. So upgrade yourself, trust on, because the God has given you this platform that they have sent you there. But now it's your turn how you can upgrade yourself. So you have to choose the right way, because you are on a right platform. It's up to you which type of train you want to board from here. Either you want to go on a hills, or you want to go on a down slabs. So that is your decision now where you want to go. So don't miss, trust on the, then sir already, it's, you can see that in a free webinar, if somebody is explaining you so much without seeing the time limit, so how the paid webinar, paid session will be, you can imagine from this only. So this is my suggestion. Rest is your destiny, what you will do, because I am from last 2.5 years. I am still connected with the AMPT, because I know this is the right. I am in a college. I am learning. I am learning everything again and again from sir. I am doing my graduation. I am feeling so. So this is the same feeling. I am following this academy. Yes, I am in a final year of my BPT. So this is the way I am learning from sir. We are missed in our college time, that we are learning here. So this is the beauty which we are following, and we never want to miss any session from sir side, because sir, today's session itself, I have noted down 3 pages, because in today's session also sir has explained in such a beautiful way all the answers. So take the course and upgrade yourself. And this time I think sir will be back. Yes, sir is here. Yes, sir. Over to you, sir. The next question is from
Yes, now we have the
K.